Thank you for your statement, Minister. I think it's fair to say that our health and social care system lacks resilience. Every year we have a statement talking about winter pressures and urging people to stay away from hospitals. The messaging changes, but the problem remains the same. Minister, what discussions have you had with health boards about accelerating the creation of diagnostic and surgical hubs? What discussions have you had with local authorities and housing associations regarding the expansion of extra care housing to relieve the pressure on social care? Finally, Minister, this lunchtime, the Royal Pharmaceutical Society were telling members about the role pharmacists can play in relieving the pressure on primary and secondary care. Minister, what discussions have you had with the sector in accelerating both e-prescribing and pharmacist prescribing?
Thanks very much. Well, you're quite right. We prepare for the winter pressures, and you worked in the health service for a long, long time, and you prepared for winter pressures. Everybody gears up for winter pressures in the NHS. So you're quite right. We are developing diagnostic and surgical hubs. One, so pleased to go and open in Neath during the spring, summer, and that's good to see that's up and running now, and you'll be pleased to hear it's an orthopaedic hub, so that's exactly, I know, what you've been calling for. We are also, of course, ploughing on with developing the hub, the diagnostic hub in Cwmtaf Morgannwg, so all of that is moving ahead. I'm pleased to see that happening as well. We have constant conversations with local government. In fact, we had a meeting with them yesterday, preparing for winter, making sure that everybody's lined up, making sure that, for example, the trusted assessor system is something that is respected on all sides, but the responsibility for a care home assessment, for example, is with local government. But if they don't do it, the people stay in hospital. So we have to work together to make sure that we unblock that particular that blockage. So that's the kind of discussions that we have in those particular meetings. Royal Pharmaceutical Society, you're quite right. I think we make significant use of community pharmacies in Wales. We were way ahead of the rest of the United Kingdom when it came to pharmacy use. We have 99% of our pharmacies now offer the common ailment system. 1 in 6 of them are offering a prescribing service. 47,000 people took advantage of that offer. 26,000 people had their throats tested in community pharmacy last year. So people are starting to hear about this, and part of what we need to do this winter is to make sure that people know that those alternatives, that means you don't go to the GP, are available.